Today is Friday, April 24th, and today I'm focusing on the very, very important role that our emergency department physicians and staff have played since the first COVID-19 patient arrived at Silver Cross. This team has been on the front line since day one and continue to do amazing work. So are you two comfortable taking off our masks for this?
Yeah,
okay,
sure.
Sounds good. So let me introduce Dr. Nejak from EM Strategies. This is the physician group that runs our emergency department, and Dr. Nejak has been with us for 2 years now. And also Jill Cherry, who is a shift coordinator in the ER. And Jill has been here since last June, not even a year. So thank you both for joining Silver Cross and playing a huge role during this COVID crisis. So Jill, let's start with you. You're a shift coordinator. And what are the responsibilities of a shift coordinator?
To manage the room, slot the patients, be a resource for the staff, just make sure everything kind of can run smoothly.
So traffic control.
Yes.
Yes. And at the beginning, as COVID patients started to come in, what changed in your...
They converted Pod C, which was fast track, to all negative pressure. So the screener at the door would call us if someone screened positive for possible COVID, and we would put them in a negative pressure room right away.
Okay, good. And that protected staff as well as the patient.
Correct.
Yes. And when you said someone tested positive, at the beginning, how did we start doing testing? How did we know what to do?
We have a screener at the door, and basically a sheet that they would follow if they answered yes to the travel questions, cough, fever, then that's how they would screen positive.
Okay, so it was more verbal screening, but what about the actual test?
In the beginning, we would do drive-up testing where they would, with security, they drive around to the ambulance bay and someone would go out and meet them and swab them, and then they would drive off if they didn't need to be hospitalized.
Right. So Dr. Nejak, speaking of that, at the beginning, it took a long time to get test results, 6-7 days. How's that going right now?
So it's a lot improved from what it was initially. Initially, it was a bit chaotic. You didn't know how many tests you had. You didn't know who you should be testing based on the number of available tests you had. You wanted to be kind of judicious with who you decided to use that on. Right now, it's about 24 hours or less.
Yeah.
Sometimes I've heard even quicker than that. So that availability has really helped us to clinically make decisions in terms of who to test, when to anticipate results, and how that might change a plan of care. So the improvement in testing as we go forward has definitely been helpful.
And when in your training, would you say you were trained to be prepared for something like this?
I think this falls almost under the category of disaster medicine.
Yeah.
And despite the number of simulations you could run, you could only be so prepared.
Yeah.
But I think what's been good is the communication not only here amongst our staff, but amongst other hospitals and across the nation about what other hospitals are doing, what works, what doesn't work, and kind of, sometimes it feels like every hour we're implementing something or we have a new question about either how to protect patients or staff, and very quickly implementing those changes. So prepared initially, no, but very quickly we're able to kind of rally our resources and make it as safe an environment as possible.
We've all adapted really quickly. And I know, Jill, initially we had, information, and then maybe the next day it would change. Wear a mask, don't wear a mask. How did staff respond to those changes?
I mean, in the beginning, I think staff was very nervous and didn't really know where this was going. But we have a great educator, and we have plenty of PPE, and they make sure that we are kept safe down there.
Yeah.
And
I remember, early on you had the face shield.
Yeah, we were all issued a face shield.
Right, good. How would you say the morale is amongst the team?
I work midnights, and staff, we support each other, and there's great teamwork. So it just continues through all of this.
Did you come early for this today?
I did.
Oh, thank you. That was really nice here. Are you on midnight tonight?
No, I'm not tonight. I'm tomorrow night.
Well, thank you. Thank you for joining us. Do you work midnights also?
I work evenings, but not the true midnight. So I'm not driving home when the birds are coming out,
Right.
which is nice.
So, Dr. Nejak, typically in our ER here at Silver Cross, we see about 200 patients a day, 190, sometimes 205, 210. I think the volume has gone way down. That seems like an anomaly right now. Tell me what's happening.
Yeah, it's a little bit of a surprise, especially when I talk to non-medical family or friends that, our volumes are about 50% less of what we normally see. So in the 100 patients per day range. Which has definitely given the ER an entirely different feel.
Yeah.
I think, obviously there's a lot of concern from the public and a lot of people are doing a good job staying home, but I also think that's led to some people being scared to come in and see us, but if you're 60s and have a family history of heart disease and you're having chest pain, that is the case. I want you to come in and see me, and that is a person that would screen away from our isolated pod, so we have an entirely separate unit to safely put a patient in and get the necessary testing to determine if there's an emergent medical condition present or if their presentation involves the need to admit them to the hospital for further testing. So I tell people all the time, they'll come in and they'll initially apologize, sorry for taking your time, we don't want to be here, and I say, look, you need to be here. So while overall volumes are down, I said this to you earlier, it's I think you hear on the news that the number, like, where have all the STEMIs gone and where have all the appendicitis gone? And I think those cases are still out there. I do think we're seeing less, but I would say the percentage of patients I see in the ER that have a truly emergent medical complaint, that is something that I'm seeing a higher percentage of during the shift. So it's really emergent conditions, COVID rule-outs or COVID admissions, and that's really kind of taken up the majority of our time.
Okay, so I hear you saying you don't want people to be scared. If they need to come to the emergency department, they will be protected.
Yeah, they'll be protected, and if you're having a new pain that you've never had before or having some symptom, then a lot of times it's better to get it checked out early and let us use our expertise to determine and figure out what's going on.
Okay, so we're still available for emergency care.
Yes.
I know initially we told people, don't come to the emergency room, call your physician, etc. But those people with really acute emergent conditions, it's safe for them to come.
We're here.
Oh, good. It's good to know that you're there for us. And Jill, do you want to add anything else or say anything to your team?
No, they're doing a great job.
They really are. They are. Thank you. And thank you for your leadership.
Thank you.
Yeah. And how about you, Dr. Nejak? Do you want to say anything to the community or your team?
I guess just, there's been a lot of appreciation for what we do. And I think that's been really encouraging to see all the signs or the food trucks.
Yeah.
But it's really, there's so many different elements, whether it's in the hospital, the EVS workers, the nursing staff, the administration, the community in general, staying in, social distancing. I think it's been this really big group effort that, at times of crises, it's kind of good to see people's true colors come out and everybody being one kind of big supportive group. So thank you to the community as well as everybody here.
Well, thank you both. And on behalf of Silver Cross, thank you so very much for what you're doing in the emergency department every day. You are amazing. Thank you.
Thank you.
Thank you.